My name is Todd Baron, and I'm a therapeutic endoscopist. I began performing ERCP independently in 1993 after having completed a year of training in ERCP, and have performed more than 20,000 ERCP procedures in my career. I first became interested in the concept of disposable endoscopes after outbreaks of multi-drug resistant infections occurred related to duodenoscope reprocessing. So I knew it was a problem in our field that we had to overcome, and it seemed that disposable endoscopes were a natural way to overcome this problem. I first was introduced to the Ambu scope last year, 2020, prior to the COVID outbreak, when I met with Ambu representatives and was able to have the scope in my hands and was intrigued by the concept or the idea of moving forward with the endoscope. I was then introduced to a hands-on exposure in an animal lab using the Ambu duodenoscope in a pig model. Of course, that doesn't replicate clinically what happens in a human, but I was very impressed of the feel of the endoscope, my ability to carry out multiple tasks within the animal, which included cannulation of the bile duct, placement of biliary stents, and balloon sweeping of the bile duct and mimicking a stone removal. I was very impressed with the way the Ambu single-use duodenoscope mirrored what the handling was like of the reusable endoscopes that I've been using for the past 25 years in its ability to turn right, left, up, down, and its ability to pass catheters, guide wires through the channel, as well as the endoscopic image. We found the setup and the installation in our lab very easy. It was compatible with our CO2 insufflator in our unit, and we were able to implement using the scope in a short time frame. It certainly makes room turnaround faster in that no pre-cleaning is needed, no post-cleaning within the room is needed, and certainly as far as overall endoscope turnover, that's taken out of the equation because the endoscope is not reprocessed. I've now had the opportunity to use the Ambu single-use duodenoscope in a handful of patients. They've all been patients with native papillas. They've been all with biliary interventions, ASE type 1s and 2s that have included, of course, cannulation, sphincterotomy in all patients, stone removal, and placement of an expandable metal biliary stent. And I've been very impressed of how the scope has functioned, and it's actually exceeded my expectations.